let's go ahead and let's start your PN Exam 1 review. Now, you should have two forms that your professor sent you. One that's a fill-in worksheet, which will help you pick from the PowerPoint and put in the correct answers, and I think that will help you. And then you also get the PowerPoint. This is the only exam we do that way, is to try to help you understand the information in those PowerPoints and how important they are, okay? So let's go ahead and let's start. I do send these reviews out pretty quickly as soon as I get them. So you should be getting them later today. And if you don't, again, I am Professor Bogart. I do not mind. You send me a message. Could you please send me that review, or please send me that dosage calc review, whether it is the recording or the handouts. I do not mind. So please, please, please let me know. As we're doing this review, if you're not understanding something, let me know. I know that some of you are week 3 is tomorrow. So some of week 3 information in here has not been gone over yet. And I know that. So again, remember, you're going to be reviewed again tomorrow. But anything, let me know. So let's just look about terms. Terms are important. We have to understand what a term is in order to be able to answer questions. Cephalocaudal. Well, think of cephalic. Cephalic is the head. Caudal would be, the bottom, which is going to be your feet, which could also be walking. So how do we develop? Well, what does a baby do first? They lift their head. And by the end of infancy, they should be able to attempt to take one step, if not walking already. Proximal distal. Well, proximal is here, close to you, midline. And then distal goes outwards. And this is the way children, infants start to see. They start seeing things here, and now they're seeing things in their periphery, and they're starting to grab on them. And that's all that means. General Pacific means we start to do things generally. For instance, we could just talk about grasp, and then we talk about pincer grasp, or we talk about a voluntary grasp, okay? That's all that means. Maturation is the way a person grows and develops, and it is dictated by their inheritance. That means, how do they grow? How do they understand? And it does depend on your family, your inheritance, how they teach you for you to be able to grow and develop normally, or even quick, depending on how that inheritance, those people help you to grow. Growth is just getting bigger. It's an increase in size. Why do you think we weigh and we do a height and weight on every child on every visit? Now, adult land, you don't do that. But in children, from birth up till 18 years old, it's a height and a weight. We want to make sure they're growing right for many reasons. Development refers to the progress increase in the body's function. Example, at birth, we don't feed infants anything but iron fortified formula and breast milk, right? Why? Well, the GI system is immature. If you gave that child something else to eat, they wouldn't be able to digest it, and it would just come out in the stool undigested. So it's a waste of time and energy for the child. So get the calories in by breast milk, iron fortified formula. Now, heredity is the factor that develops that maturation. Hereditary, again, family, where you were grown up, what your culture is. This is, your grandmother, grandfather, all about who they are, what sort of conditions do they have. All of that you can inherit, whether it is sickle cell anemia, right? That's one good example of it. Nuclear is a type of family, and this is the normal one. Well, quote, normal of olden years, but it's you get married once and you have children together. That's nuclear. Now, extended families are other people, for instance, the grandparents, other children, other relatives. That's all the everybody. That's your sister's kids, your brother's kids, that's everybody else. Nuclear is just a husband, a wife, and their kids, and they had them all together. Now, blended, this is probably what every family or many, many families today is. I know mine is. I have two children. My husband has three daughters. I have a boy and a girl. Together, we have a blended family of five. Alternate is that communal family, and that could be a church family. I have seen communal families, for instance, in when you have migrant workers, they come in and they work and sleep together and house together. That becomes their family. So it's not necessarily related by blood. There's just a common interest, whether it is they're that migrant who comes in to make money or the church family there just to worship. Extrusion reflex. Now, when infants are born, they know how to suck, swallow, and breathe. They don't know how to put something in their mouth and get it down. So their tongue comes out, "Nyeh, nyeh." And you think they're saying, "Ooh, I don't like that." It is not that. It's a reflex, just like grasp reflex, but it's the tongue comes out until they get used to putting that food in there and then they can swallow it. That's why you're always with a spoon scooping up their lips and getting it back in because of that exclusion. That tongue keeps coming out at them. That grasp reflex, we know that initially it's just a reflex, right? That means you touch around the area of the fingers and all of a sudden they wrap around it. You see that a lot with newborn infants. In the newborn ICU, I saw it quite a bit. Parents put their fingers in and the baby would grab their finger and they go, "Oh, look, my baby's hugging me." Well, I'm not going to tell them it's a reflex. It becomes voluntary, but right now that was just a reflex. Now, apprehension is the ability to grab things or call it a pincer grasp, where you can like pick up a little Cheerio, put it in your mouth. I mean, it starts crude, but it ends up very fine. Exclusion reflex. Apprehension, excuse me. Parachute reflex. Ever take an infant, turn them on their belly, and put them down on the floor? Their hands and their legs go out. It's a protective device for them. They protect their heads, believe it or not, with it. And that's somewhere about 9 months old, you're going to see those things. You don't need to know the time, just what it is. You know their hands and their feet coming out. Negativism. These are toddlers. What do toddlers do? No, 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 mine, me, egocentrical. Toddlers, negative. And it's not that they mean to be negative, it's just they don't know how to share yet. They don't know anybody without around them. They just know it's all about me. That's why you need to, with these children, have a ritualism, which is doing the same thing all the time. It gives the toddler a sense of security and comfort. Without that, they get stressed, they don't know what's coming on, and it could create a child, especially the toddler, absolutely, they're going to be frustrated and they're not going to be happy. That's why I say taking a toddler on vacation is very hard. They want nap time, they want the same foods, they want the same routines. Personality is that characteristics that determine the individual's typical or recurrent patterns of behavior. You know, you're going to have children that are happy all the time, and you have children that just don't respond much, and some, that are in between. That's all personality. And of course, it does depend on environments. Parallel play again. These are children playing next to each other, but not with each other. And usually this is toddlers. Me, mine. I'm not going to share. You stay there, you play. I can play over here. Not a problem. And as I said, egocentrism or egocentrical, absolutely toddlers. They don't understand anybody but anyone else, but themselves, and they don't want to share. And that's part of the toddlers. It goes over into preschool, but mostly that's toddlers. Now, theorists, as I was saying earlier, there are 7 questions on different theorists. And what do you need to know? And what do these things mean? Well, when you talk Freud, it's anything sexual, right? Body parts and just sexual. So it starts out with, what do infants like? And what do they do? Well, they explore the world in their mouths, right? Everything in their mouth. A pacifier, a non nutritive sucking device, right? And they suck it and it calms them down. Takes the stress out. It's what they like, oral. Well, then toddlers, these are your potty training kids. And we know that bowel training is before you do the urine. It works that way. So we call it anal. Phallic has to do more that, mommies like their sons like their mommies and girls like their daddies. It's just part of what Freud says. Latency is all about same sex peers. And then when it gets to genital, again, this is their puberty going on, and these are sexual innuendos. They want to, whether be attracted to opposite or same sex, depending what your sexuality is. Again, that is your adolescent. Now, Freud, as I said, stages of orality. The infant explores the world through their mouth, right? Everything in their mouth, fingers in the mouth, thumb in their mouth, pacifier, rattle, doesn't matter. Anality has to do with the toddler learning to take and say, no, no, mine, mine. It's also with bowel training. The phallic stage, again, they're starting to understand boys and girls. And that's why the girls are with the boys and the boys are with the girls, moms and dad, etc. And then it goes up to the school age, which is latency. Why are these words? I don't know. They could have made them easier and some sort of thing to relate them to, but they don't. It's just something you have to remember. Again, Freud, same sex relationships and how to get along with them. Now, Piaget starts out with they're all about learning, thinking, and building upon that thought. They get a rattle and then they they grab it. Well, then it comes to their going to voluntary grab it. And maybe their hand shake. Oh, they heard something. I like that. And they shake it. And then, of course, in the mouth, they explore it. That's what that means. Pre-operational, they have to see things, okay? They don't understand unless they see it happen and then they can build upon it, okay? They can't develop these logic and reasoning yet. Concrete is now understanding that there's things that I've seen and I can figure my way out of, okay? That is school age children. If they know about being right and wrong, which is a lot of what school age is all about, they know what things are right, what is wrong, that causative to the reaction. It's like, if I do this, this is going to happen. Now, formal. I call this where they can make up a story out of the air 16 different ways when they want to get their own way. They're very bright. They're logic. They reason. They know mom likes, let's say, a clean kitchen. So all of a sudden they come home from school and see it a mess and they clean the kitchen because they want to go out Saturday night and mommy said no already. Well, they know what to do, and that's formal. Sensory motor, pre-operational, I've given you some things. Another thing, concrete, operational. I'm sick because God is punishing me, part of it. Why did I get sick? All of these things. This is what they're thinking. They have a reason. They think will say why things are happening to them. It's because they've seen it already. And again, that formal operations, they can figure out anything, those adolescents. Now, Erickson. Erickson is the most tested of all the areas in theorists, whether it be the exam, whether it's the HESI, or whether it's your NCLEX. They love Erickson. So let's first just talk about an infant. Well, an infant can't talk yet. They can't express. You don't know what they want until they cry. And if they cry, mom or dad or grandma, whoever, picks them up, feeds them, changes them, burps them, whatever they need, they're happy. So they're trusting. Now, there are some times in some families, whatever the reason, is infants are left to be there, cry, be wet, and it's repeated, not just once, but all the time. Could be due to divorce, could be drugs, alcoholism, violence, could be many things that have caused that. Um, uh, it could even be something like postpartum depression. You just can't deal with the baby. So that can make an infant mistrust you. So trust is very easy. Just pick it up. All right. Now, toddlers. Toddlers, again, what does autonomous mean? Autonomy. I'm autonomous. It's all about me, egocentrical. I want to do, let me do. So again, toddlers, what are they? They're into everything. They're in exploration. They're all over the place trying to figure out life, right? Well, what is that shame and doubt? Well, what do mommy, daddy, and grandma on the side do? Oh, don't climb on the couch. You can't jump. You're gonna fall. You're gonna hurt yourself. You're gonna bump yourself. Well, sometimes you need to let them do stuff. Because that shame and doubt can overcome that being autonomous, doing for themselves. Goes up into school age. We'll go there next. Industry versus inferiority. Now, why the name industry? Well, let's sort of look at it as an industry is building a house, right? Building a business, industry, and you do it really well. Well, that is industry in school age. What they can do and do it well. Are they good at sports? Are they good at math? Are they good at spelling? Are they good at what? And what they're good at, they feel great at. Now, you can't be good at everything. So that's the inferiority. You have some kids that are great on the soccer field and they can't add 2 plus 2. They're inferior. So, as nurses, we always tried to challenge children in the school age period with something, but something that they will be able to succeed with a little bit of effort. Okay. You don't want them to feel inferior about themselves. That boosts confidence. And then as we get older, we get into those adolescents, it's identity versus confusion, is one way to talk about it. So, identity, who am I? What am I going to be? Who do I like? Who are my peers? They need to fit in, and they're confused about all of this stuff that's going on. So, infants, trust versus mistrust, as I said, they cry, somebody comes. Toddlers, this is all about my mind, me. I want to do, they should be feeding themselves by 2 years old. Now, the spoon might be upside down and backwards, but it doesn't matter. They're attempting to try. They may be getting dressed, maybe inside out, wrong way, whatever, but they are attempting. And they're learning how to tell you what they want and need. And their language is not great yet, but they're want to try to show you what they want. You know, preschoolers, it goes on with trying to do things for people, trying to do things for selves, and then feel guilting if they're not doing it as correct as they should. Basically, what that means. School age children is, what do I do well? What task do I do well? And am I getting that praise? I want to feel good about myself. And that inferiority is when you just can't do it and you feel bad. I mean, you can't do everything good for real. So, identity role confusion, as in your adolescence, again, it's what am I? What am I going to be? Where am I going to school? Am I going to be an astronaut? Am I going to be a nurse? Am I what? Do I like girls? Do I like boys? Am I going to be in the band group, the sports group, the nerd group, the future nurses group? What am I? And this is all about identity. Now, Maslow's. You need to understand what this hierarchy is. Number one is your physiological needs. This is if you're doing vital signs on a child, that's a physiologic part of Maslow's. What are they eating? How are they sleeping? And then it goes up to esteem. Again, it's almost like an industry. What do I do well and I get praise for? So, and everything in between, okay? Now, Kohlberg. This is about good and bad and a consequence for each. All right. We know that um, infants don't understand. We know when it gets up to about preschooler, they start realizing they're going to try to get the praise. So they want to be good. It's the punishment and reward sort of thing that's going on there. As it gets to school age, they don't want to do things that are going to get them punished. They want to do good things. They're always trying to do good. And then Kohlberg, as your older children, they're just trying to do what they need to do to fit into society, like doing the right things. They know that they can't be doing things, they could be arrested, shoplifting, or they know they need to get their homework in. They know that's good. So they know to get ready for when they move out of the house and they're living on their own. So, infant. A neonate is the first 28 days of life. So, first 4 weeks. After that, we'll call them infants. Although the whole stage of the first year is their infancy, okay? But you want to be specific. First 28 days is neonate. Now, how do children gain weight? Now, the first year of life is incredible. You go from a 7-pound child, born infant, and then by 1 year old, they're 21 pounds. Also, the first 6 months of their life, they are going to grow an inch. So they're at least 6 inches taller. So their weight, and that's why we measure it, height and weight, every single visit on any pediatric child, especially infants, is they should about double their birth weight by 6 months. And they should triple it by 1 year old, okay? And if they're too little, too much, then we do some interventions. They should be about 29 inches by the end of the first year, and most children are. Again, we have hereditary in there, so not always. Now, by 1 year old, they should be attempting to take some steps. Doesn't mean all kids are walking by then, but they're upright on their feet, attempting and falling. That's attempting. They should start about 6 or 7 months, start with teeth coming in. Again, they all don't come in, but usually that's the earliest you might see. Remember, first 6 months is only breast milk or iron fortified formula. Again, because of the prematurity and their GI system, it's not mature enough, right? So about 5 or 6 months, we start to introducing food. Again, remember, we feed them food first, and then we give the milk afterwards. What do we give first? Well, we want to give the least allergenic food, and that's actually rice cereal. So we start with rice cereal, and then we will be giving a new food every 4 to 7 days and introduce one at a time. But we'll start with that rice cereal. Now, sometimes parents want to make their own food. I mean, I have this one girl that I call my daughter. I've known her since she was 3, and she has done all of her food all by herself. She just feels that's the best. That's a choice. Now, what do we need to know if they're going to do that? And what can we educate these mothers and parents by? Well, don't add salt or sugar. Do not put much water in there because you don't want them to get empty calories, right? Another thing is no honey till the age of 1. It can be very, very dangerous for younger children. Okay. And then what you do is take the strained food out that you've made. Let's say it's all carrots. So you haven't put sugar, salt, no honey. There's minimal water in it. It's soft. It's strained. We're good. All right. Put it in that little ice tray. And one little cube can be a serving. I mean, they say 1 tablespoon of food per year of life is all they need. So the development of trust we know begins as infancy. And we know if a baby trusts, this is going to be the happiest, sweetest kid you've ever met, right? Because all the needs are met. Sensory stimulation is part of the development. And who is this? It's all about Piaget, thinking, cognitive awareness, right? Techniques to cope with a lethargic infant. Now, you've got some kids, infants that are just not as perky as other. They're calmer. It looks calmer. They looks lethargic. Now, the one thing you don't want to do is overstimulate these children, these infants, okay? Avoid bright lights. Don't move quickly. Don't handle them quickly. Talk in that very calm, slow voice and having them sit up. You just look around and see their environment. These are things that we should do. Health maintenance is so important. Think about the amount of immunizations that we do give these infants in the first year. We give one in the hospital, Hep B, and then we're giving it 2, 4, 6 months, and 12 months. So health maintenance is important. There's a lot of physician's office visits that need to be done in order to get all of these immunizations in. Remember Sid's death? This infant today is only on their back. I have watched the evolution of this for many, many years, but it's now only on their back. In fact, the area hospital where I used to work at, they called it back to sleep. And they were doing a lot of research and following up on their NICU infants at home. So the only time they should be placed on their abdomen is they're wide awake and alert and they're doing tummy time. And this helps with the head so it's not so flat in the back. And it's just that little time helps. Remember car safety? It should be in the rear facing. It should be in the center of the car. We always put it right behind the passenger so as a driver we can see, right? No, should be in the center of the back car and make sure it's strapped in properly with a seat belt, okay? So less than 2 years old, they should be in rear facing in the center with it strapped in properly. One of the things that is used a lot for infants, especially the really young ones, is to carry them around in slings. Be careful. Sometimes the mouths get covered with a cloth and they can suffocate. So make sure that their mouth and nose are open so that they can breathe. So diet, toddler. Well, you get a child who's a little, say, a little bit heavy at 1 years old. You would not compromise giving them the whole milk, and that starts at 1 years old. Whole milk, and you can stop breastfeeding, you can stop iron fortified formula. Many parents don't, but you can add the whole milk. Do not go low fat. They need it for their central nervous system. It will compromise growth and development. So, no low fat. You're not going to do that. Toddlers are ages 1 to 3, right? The birth weight should quadruple about 2.5 years. You can see it slows down. The changes in the toddler, you see them at 1 years old. They are, very clumsy and they waddle when they walk, right? They're going to be getting those fine using the finger motor skills, okay? And gross get up and go, go, go movement motor skills. And this helps. Their eye coordination, depth perception, hand to hand are all getting better and better and better. Now, as an infant, we fed these infants like every 4 hours, right? Well, now as a toddler, breakfast, lunch, and dinner is fine. Maybe some snacks in between, but it's not as every 4 hours as it would be an infant. They say you should have bowel and bladder control by about 2.5 to 3 years old. Again, not all of them are done by 3, but that is the average and according to your book, okay? Erickson and the toddler, we know it's all about that sense of autonomy. What is autonomy? Being autonomous. What does that mean? Me, mine. I'm not going to share. And then that shame and doubt again. Somebody telling them, don't do that, don't jump, or doing it for them. They need to try to do things, okay? It builds up that big self-esteem. We know that big cognitive achievements are all about their language, the words. We know it increases as they get older. They should have one-word sentences by the end of a year, and it gets more and more and more, and they're understanding a lot. Self-regulatory functions like going to the bathroom. They should be able to start doing these things at by 3 years old. And they're just starting to speak better. They're starting to run better. They're just growing up and getting more mature. Now, separation anxiety. You're going to have a one of your discussion questions. It's all about protest, despair, and detachment. What does that mean? Well, you have a toddler, okay? The one that does not like a change in routine. And this toddler's admitted to a hospital, and mommy can't stay. She has to work. She has 4 other kids at home or whatever. She has to leave that child there. So, what is you going to see in that little toddler? You're going to see them protest at first, scream, yell, go bonkers, and it's going to take a while for them to calm down. Then they realize, nobody's coming. So then they start self-soothing. They could go back and start sucking their thumb again. They could go back and start needing potty training again. They could need a diaper on. These things happen. And then that detachment is when mommy finally gets back and the toddler just doesn't want anything to do with mommy. And it's not uncommon. This is called separation anxiety. Again, negativism, temper tantrums, sibling rivalry are all about the toddler. So, discipline on these children is you need to teach them what they did wrong. And timeouts, 1 minute per year. A 6-year-old should have 6 minutes. A 2-year-old should have 2 minutes. And they need to be told why they're on timeout. So preschoolers, we know that they are getting ready to go to school. They are learning to play together with other children and a goal at the end, whether it is working together to build a house of blocks or playing a board game of their, level that's appropriate for them and somebody wins. They are easier now that separation anxiety isn't as profound as toddlers. Their communication. They can tell you exactly what they're thinking right now, and their attention spans increases. The preschooler is ages 3 to 6. Gross, think of get up, go, 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 like Paw Patrol. That's gross motor skills. Fine motor skills is fingers. So it's what you do with your fingers. So we know gross, get up, go, go, go. A preschooler should run, skip, and with fine motor skills, draw pictures. They can even button their buttons. Fine motor skills, okay? Piaget, they are one about symbolic thought processes and languages. They're starting to think more about, for instance, putting their arms out and going around the room and being an airplane. That's part. And they'll be able to make the noises of the airplane with it. Erickson is that sense of initiative, doing things, getting dressed for themselves, taking their shoes, simple tasks, putting them away, etc. And then Kohlberg, again, right and wrong, and the consequence for each, but they're starting to be aware that, mommy don't feel good. Let me go give her my teddy bear. She'll feel better. Or let me kiss the boo-boo and make it all gone. That's Kohlberg. We know that language is amazing. It develops quickly. Infants are cooing and crying by 1 year, mama, dada, nana, if you're lucky. I had that with my last grandson. And by the end of preschool, some of the words that come out of these children, complete sentences, is quite amazing. Children at all ages, even us old people, there's a play that we do, whatever it is. It helps with the physical and mental well-being. It also helps them communicate needs to another person, how to socialize, and this is part of getting them ready for the society, how to get along with other people and make things work. We call that cooperative play, that imaginative play. It's all about two or more kids together playing with a goal. Remember, associative play is there's no goal. They're all just playing together, doing whatever they want. But when you cooperate together. So social issues, they have learned how to share now. That's how they can do cooperative play. Some of the concerns of parents of preschoolers is things like how to set those limits, how to say you love, your younger brother Joey better than me. These are things, that sibling rivalry that goes on. And they're starting to some of them still suck their thumbs or fingers. I know my little girl, when she was young, used to suck her just index finger. That's what kept her happy. Usually it does go away by the time they enter school. And hopefully by 6, so that their teeth don't get malformed when the permanent teeth come in, okay? And remember, they're starting to explore their sex parts. And they do start this masturbation. And if we see that going on as parents, we need to teach these parents to just walk away and say, okay, come over here. We need to go take care of this now. Don't draw attention to it. It's not bad. It's their stuff. Let them play with it, okay? Unless it becomes something more than a single event, all right? Enuresis or bedwetting, there's different types. There are children who are never dry. And then there are children who all of a sudden starts to have a couple accidents. So, and that's like after they've been dry for about a year. Now, primary, that's something to deal with, but secondary could be due to a medical concern. Could be diabetes insipidus, urinary tract infection. These things can cause them to bedwet. So this is something that should be investigated medically. Now, school age, ages 6 to 12. Increased independence, they're starting to do things, perfect things, and now they are taking these skills that they do and figuring out what they want to do the best, right? Because they want to have that industry, that task they do well, okay? That's their accomplishment. Freud, again, is all about sexual latency, has to do with same-sex peers and working together for goals together. Piaget, concrete operational, okay? Again, being able to know something and then build from it. It is not that they can figure things out well, right? That is formal operations. They can, as I say, figure their way out of a paper bag. That's your adolescence. But school age children, with what they have, they work with, and they try to be those children that are good and follow those rules. Remember, during those school age children time, the growth, the height, the weight is very slow. I mean, 6 years altogether is a lot, but every year it's stair step. It's really slow. School's important. It's getting them out of the house, the family, and now they're learning other children, and now they're getting accepted by groups. They know that they are, when they can do things, when they're productive, self-directed, I do by myself, they're going to get that positive influences. They're growing up, and the praise is very important. Again, it's same-sex peers. We don't really go to opposite sex till more of the adolescence or that puberty, but usually school age is same-sex peers. Their language, again, they're getting more and more sophisticated. They're able to communicate themselves very well. They understand, uh, they experiment with words without fully understanding their meanings. What was the one word Christian was doing? It was all about floating objects or something. Anyway, uses it so inappropriately, but somehow in their way, when you ask them to understand, explain it, they can make that word work for them. But it's just using it. Moral development, again, they're going to not do bad things because they don't want to be punished. And they want to do the right thing for the praise. Team sports, again, is that, ego, that, it is that feeling good about themselves. It's the highest level of Maslow's, right? And then how do you address a child who's struggling with focus and attention? Well, you have a school age child who sits there. Let's say you're the school nurse and the teacher sends you a child and they're not focusing and they're not really paying attention. Number one, don't assume that they're not paying attention. Number one, do hearing test and vision test. And that could be it. And the child doesn't even know they're not hearing. Okay. It could be that. And adolescence. Well, we know the adolescence is the end of being a kid and now trying to be an adult by the end. So we will see all those secondary sex characteristics, that start to show, the breast buds and then the enlarged testicles. That's the boys and girls, first thing that start to happen. Erickson talks about that sense of identity, right? Again, they are prefer to be away from the family, but they need a group to fit in. They are starting intimacy, right? Freud says that all about that. And now they're trying to figure out who they are. And then there's so many more things than that. Who do I like? The boys, the girls. How do I like my hair? Am I too skinny? Am I too short? Am I too tall? All of these things, they're considered and worried about, and that identity that they're looking for. Again, Freud, it's all about psychosexual, experimenting, that genital stage. And Piaget, remember I told you formal, figure their way out of a paper bag. They don't have to see things before, they can figure it out. It's really good critical thinking skills. And sometimes they come up with these things and do things for the parents to get what they want. Is quite amazing. It's like, how come you don't put that much effort in your schoolwork, right? Physical development, again, we know that prepubescent growth spurt, they're getting taller, they're getting thinner, they're starting to look more and more like adults. We know that menses is going to happen um, usually 2 hours after the beginning of the puberty, 2 years after puberty starts, and we know all those changes are going to be making. Now, adolescent years, especially those beginnings, remember, they are rapidly changing, right? They're getting taller, they're getting breasts, they're getting hairs. It's very important that we as nurses make sure they have their privacy. Also, there's so much stress of your adolescents. They're at that breakaway point, almost out on living on their own, and they're realizing that. And it's hard to deal with mommy and daddy doing what they want, and then school and sports, and then let's say they're in dance, ballet, trying to get all of this done, and that's a lot of pressure on them. It is important that we tell parents to try to maintain that open communication and hopefully trying to keep directing them for those positive life choices. One of the hazards that kills many adolescents, well, motor vehicle is always number one, and remember, gun violence, because, they think that guns are okay. So you're going to see, that going on. How to assess and educate as a nurse? Well, we have our ADPI, right? So you need to know what ADPI is. So you assess, what do you see? What can you look at? What vital signs? Get your data. That's observation and data. Then you have to say, what do I need to do? Let's say the assessment showed that you had a temperature of 101. Then you're going to plan. You're going to look at when the last medication for fever has been given, when, how, and what you're going to deliver as taking care of that fever, and then you're going to implement it. Now, implementing could be giving them that Tylenol. It could be turning down the air conditioner, taking off a blanket. It could be giving them a cool drink. That's all implementation. There's a lot more than just giving that medicine. And then we'll go back and we'll evaluate it. Did it work? I'm going to take a temperature again. And are they temperature down? Okay. So appropriate nursing diagnoses, you know that parenting coping skills are part of the analyst and nursing diagnosis phase, okay? So how are they dealing with these things? Now, a Denver 2 test, it is not an intelligence, it's not an IQ thing. What it is, it looks at these developmental levels, their gross and fine motor skills, right? Are they able to communicate, be around other children, and is their way that they use their hands and the way they run up to where their age group is? And all it means if you don't score where you should, you need more evaluation. And that could be the institution of speech, physical, occupational therapy. And that can help some of these children get caught up. And what's so great about kids, they get caught up really, really quick. And that's what I love. Timeouts, as I said, 1 minute per year of life. And again, make sure they know why they're on timeout. The BSA is the most accurate way of doing drug doses. It was in your calculate with confidence, and students were like, why do I have to do it? I don't understand it. And what I've told them is just understand it is the most accurate. But we, as pediatric nurses, they're always mics per kilo, milligrams per kilo, MEQs per kilo. This is the way that we give doses of medication for children. How do you teach sex education to adolescents? Well, adolescents are those children who probably are exploring, right? So if they're asking, you need to verbally, orally tell them and give them written information, okay? It is not your opinion to say you shouldn't be having sex, because if this child is asking you, you need to know where to direct them. So, healthcare adaptations. Well, medications for children are different than adults. We don't give 2 Tylenols to children like we do adults, right? So again, it's milligrams per kilogram. Also, some medications can't be given at certain ages. For instance, you can't give Motrin for the first 6 months of life. At 6 months old, you can give that ibuprofen, okay? So it does make a difference. Remember, as we give medication, there's absorption, distribution, metabolism, and excretion. Remember, this is different in children than it is adult. It's not, some of the metabolism isn't done as well, or excretion may be delayed because the immaturity of some of these body systems. So that needs to be taken in account. Children are all unique and different. They react to different diagnoses all differently. Adults, basically the same way, but children no. So just remember, it might be the first time you give an antibiotic, these kids will get a reaction, or it might be the last dose. So you don't know. So they are extremely less predictable. Again, it's kilograms must be the weight so we can give our medications. We give IM injections for your young children in the vastus lateralis. That's the upper outer thigh, okay? And as they get older, for the adolescents, it's ventrogluteal. It's not in the buttocks, it's on the side area, and we give it there. Do not give it in a deltoid. A deltoid, especially some of the steroids, burns, and it's the worst thing you can possibly do for them. Even bicillin, that thick white liquid, it's not good in an arm, so that's ventrogluteal. Be very careful with children with IV fluids. You are so lucky today. There are IV pumps all over, and I have never given IV fluid to a child without an IV pump unless they were in the trauma room. But I've always had IV pumps in that pediatrics. Remember, 100 mLs on an infant weighing 3.5 kilos could put them in overwhelming congestive heart failure. Remember pacifiers. These pacifiers are self-soothers. There are children, due to diagnoses, whatever it is, that they can't eat. Give them that self-soother. Give them that pacifier. It does help them calm themselves. Now, how do we weigh intake output in an infant? Well, anything that goes in, we can measure. Now, everything that comes out, you're like, it's in a diaper. Well, a dry diaper on a size 1 weighs 30 grams. You take off a wet diaper and you weigh it on a gram scale. And let's say it weighs 60 grams. You subtract 30 from 60 and you have 30 mLs of fluid, which is 30 grams of weight. 1 gram is 1 ml, and that's how you do output. So make sure you know your math, okay? You're gonna have questions on mLs per hour. You're gonna have questions on figuring out pounds to kilograms. You're also gonna figure out proper dosages. Why should tetracyclines be avoided the first 8 years of life? Well, years ago, back in the 50s, in the 60s, it was the big antibiotic used all the time. It grays the teeth and it's permanent grayness. So you don't give them under 8 years old. Leading cause of death in children is unintentional injuries, and motor vehicle would always be there. And then what is a latchkey kid? These are the children where mommy aren't at home. So they have to have a key and go into their house. And remember, there are risks for accidents because they're on their own, because they're stressed, and they could have things like fires. And again, maybe there's a pool in the backyard and they go in it them own. So again, latchkey kids really need to be taught how to be on their own. Does anybody have any questions?